That's why I hired a helper here.
Yeah, there we go.
Yeah.
Best helper in the world,
This
right?
is the best helper. There's too many buttons to press. Marc Wagner here, Dentist on Demand, Dentalbytes. I'm joined by some of my favorite people in the community, Mauritz and Leana Lundt. Welcome. JVR Dental. This is not your first. I think we've had you guys on. Whoa. Okay, we're good. I think we've had you guys on a few times now. It's been,
Yes.
This is number 3 or number 4.
Yeah.
This is great.
Yeah,
This is kind of like an annual checkup. See how you guys are doing.
Love it.
Yeah.
Love it.
Awesome. So let's get into that. Like, it's been a wild ride. Like, we started off the journey. We've had this conversation.
Yeah.
We've had the, from South Africa to Langley. Now we're here. I want to hear about, you guys are quote unquote our poster child because you're just doing everything so amazingly. Your practice is thriving. Everybody loves you. Dentsply Sirona has you doing all these amazing things and you're all over the place. I want to hear all about it. So let's get into sort of the beginning. You're breaking ground into the new practice. What was the first mission with that to set yourself up for where you are today? Like what things did you know going into it that you needed to put into place to really, be at the spot that you are today?
I think, honestly, when we started the practice, I never envisioned having a big office. My goal was to have a small office with a few people working there, with a few patients, and we'll just do it great.
Yeah.
So I think that groundwork was done from the beginning, and we had Bianca from Practices Made Perfect that helped a lot in the beginning, getting us there. And then when I started the office, our oldest was only 5 months old. And I realized pretty soon after that I need help. But because I'm the dentist, as soon as I step away, there's no one doing the work. Mm-hmm. So that was kind of where we started thinking and communicating, and how do we get me or the office running without me in the office? And that was where Bianca was like, well, we have to get the space next to you and expand, because you'll need more dentists for you to be able to go away. I mean, my staff loved taking 3 weeks off when I went to South Africa, but that is not realistic, a goal to have for an office, right? So we had to get through that. And then as our family grew and we're like, family is really important to us, how do we bring business with practice and getting that balance between all 3 aspects, basically?
Yeah.
How do we do that? And that's how we kind of went into let's expand and get more people around us to support us and to grow the practice.
So you really goofed up that small boutique idea. You really goofed it up.
Well, I want to think we still have a small boutique office.
Yeah.
Just in a bigger setting now.
I think the whole idea of the boutiquiness is just that intimate setting.
Yeah.
Right? Where it is about the people and you're not lost in sort of the noise of it all.
Yeah.
You guys have done that in spades. Like, it's such an inviting place. Your team's awesome. Also, another piece to the puzzle is the technology that you guys have in the practice. Mm-hmm. What does that mean for you? Like, you got all the tools. I mean, yes, it's a lot of bills, but like really your scope of practice is like,
I actually had a conversation earlier this week with a gentleman, and we talked about the technology, and the technology is not there necessarily to show off.
No,
it does help. I know some patients like that, and there's a good appeal for that. But the big thing it does, it helps the dentist do dentistry easier, more efficient. And I think that the the biggest advantage of the technology in a lot of things, and the way we apply the technology is that it creates and helps with patient comfort and trust and getting consistent work done every time we do it.
Right. And also, in terms of taking the patient along for the journey, having these tools to really show the folks, this is what we're looking at.
Yeah.
This is what we want to do. Yeah. Like, trust is everything when it comes to a patient, isn't it?
Oh, yeah.
And I think we scan all our patients in the office, and seeing your teeth big on a screen.
Yeah.
You're basically co-diagnosing. Like, we're not diagnosing stuff that the patient can't see. We can show it to them. We can open up the screen. We can show them where the cavity is, where the discoloration is. The other thing we have now is the AI to help with the x-rays.
Yeah.
And that is, again, just another level, building trust with the patient, showing them like we care. And we want to make it as easy and predictable as possible.
Did you guys implement DiagnoCat? Is that what the AI?
No, we have Paul.
Okay.
Second opinion.
Yeah.
Like, honestly, AI is like, even for front end, like running the practice, like it's interesting to see AI sort of like a
creeping
into every aspect, right?
Yeah.
But it's been such a great tool. I think it's like having another person in the practice.
And a lot of people are afraid of it because they not sure what the capabilities is.
Yeah.
But I think if you control it well and implement it in the right, don't use AI to try and replace people.
Yeah.
But use it as a support mechanism. Mm-hmm. I think if you handle it that way, it's
humans were afraid of like getting into a car from the horse.
Right.
So it's always like, I think maybe an instinctual thing to just be cautious with anything.
And that's good. It's good to have. It's good to do that. But it's such a big support.
Yeah.
And it can take a load of people to, especially the everyday stuff.
Yeah.
And then I just feel like the technology in itself it brings the team together.
Yeah.
Because it's something that everyone learns. Like, there is a learning curve to implementing any new technology. But for my assistants to actually make a crown now is so amazing. Instead of just sucking spit, they are showing the patient a crown that they made in a 20-minute period.
Yeah.
And that is amazing. Like, they love their job so much more because they have these technology stuff that they can use and they can do so much more. And be so much more creative and I think enjoy their workspace more.
Yeah. I mean, I've seen all the Dentsply Sirona stuff. I could like maybe call me a DS fanboy. I think well, yeah. But I think obviously they're ahead of the game when it comes to like, are you guys utilizing DS Core in the practice? Yeah. So like not only are all the pieces doing what they should be doing, they're all talking to each other. It's seamless.
And that DS Core has been a game changer in a lot of sense like that. It's communication and transferring information and bringing information together, not just for us, but also for the patient.
Yeah.
And then sharing it with the lab or specialists and all of those kind of things.
And really this is not, where's the camera here? This is not a Dentsply Sirona advertisement.
No. Not at all.
These lovely people have really embraced DS and all the great things that it has, and it's cool. Like, I've seen a few really state-of-the-art practices that are like, wow, they've really got this stuff figured out. It's really cool.
And the thing for me personally is I will speak highly about Dentsply Sirona, but purely because I don't know anything else. That's what we use.
Sure.
It's been working well for us, and I have nothing to complain about for them, and I can't say anything bad about anything else because we don't know.
Yeah. I think the point is when it came time to starting everything, it was, you had the list of choices. And at the end of the day, everything's a tool, including the chair.
Yeah.
So which tools would you use the best? Which like, we all have a choice on which brand of shoes or whatever. Like, it's okay, we're going to use this, we're going to invest in this, and we're going to use it. Like, you want to make sure, and I think probably this is another important point, you're utilizing everything to the full capability.
Yeah.
right? I see it a lot of cases where folks maybe have invested into something and they maybe not are using it to its full ability.
Yeah. I think what I love about everything is just how they integrate and everything can communicate. And that is a big thing where DS-Core brings all the technology together. Mm-hmm. Like it's one spot where we have 3 scanners in our office. Mm-hmm. And before DS-Core, we were literally like, okay, we did a scan for Marc. Which scanner is it on?
Yeah.
Because otherwise you kept creating the same patient on different scanners and you never have one central place where you can see all the work and you can compare the scans. Now all your scans goes to one spot. All your CBCTs goes to one spot. All your intraoral pictures and X-rays, like everything digital has one spot now.
Yeah.
So when you open up DS-Core, you can be like, okay, Marc has a CBCT. He has an intraoral scan. We have a profile picture for him. We have intraoral pictures for him. Like everything, it's just bringing the whole office and all the chairs together in one spot is amazing. And we're not wasting time running around trying to find where is the scan, where is this.
Yeah.
And so, that brings us back to our philosophy when we started the office. And that's how we came to DS-Core. Was one of the specifications we had is to do all types of dentistry in any op.
Yeah.
And the Dentalbytes Rona chair was the one that could bring us all of that together for us in one spot.
Yeah, because you could flip a chair over from hygiene to doing an endo.
Yeah.
Yeah, it's pretty cool. Yeah.
And that is literally within, you take a handpiece off, you put a new handpiece in.
And Bob's your uncle.
Yeah. So that is, it's amazing.
That's the reason why we went with DS, and when we expanded the office, we looked at other options too, but because we were familiar with Dentsply and how it worked, it ticks all the boxes again for doing all of that. We are now of a chair that can do everything and implants.
Yeah.
So all of that is all in one now.
It makes so much. I gotta just one thing here. I just gotta make a comment. You're doing an excellent job. Like I don't even have to worry about this stuff. It's great. Thank you. Keep it up. Yeah. It's great, and it just makes in terms of thinking into the future, and we'll get there. It just makes so much sense, and everything just kind of integrating, and like at the end of the day, that running around and figuring things out after every patient, after every treatment procedure, that time adds up.
Yeah.
Right.
Yeah.
And that turns into just production time and takes the focus away from the patient.
Oh yeah.
No. Ultimately, right?
Yeah.
That's the name of the game.
Yeah.
And again, this is not a DS sponsored advertisement.
But Marc, to come back to your original question, so how did we set ourselves up to get us to where we are now? One thing that Bianca helped us a lot with, and that we realized, luckily, soon after we started the office, is that we can't do this alone.
No.
We need a team and people around us with different expertise, different support.
Good.
And we've been so fortunate that we were lucky to surround ourselves with amazing people.
Yeah.
Segued into the next topic I wanted to get into, because I think, great, you've got the technology. That's the good foundational piece. The people are what make it.
Yeah.
Right.
Oh, absolutely.
And you guys have an awesome team. Let's talk about sort of how, like we've touched on this before, but in bringing those folks into the practice, what was that process like? Like, how did you vet them?
Yeah. Some of the early starters with us were staff that work with Leana at that she encountered at previous offices that she met there, and then when they heard that Leana's opening her own office, they set themselves up to join Leana when she was ready. So that was how some of the core people started. But for me, the biggest thing that I do when I vet people is not the technical things, because I feel like those stuff I can train, but
especially with technology, most people aren't trained on it, right? So
for sure,
you have some training to do always.
Yeah, I need to have a person that is trainable Because there's some people that they don't feel the need or don't have the need to train more, learn more, and maybe then our office is not for them. But the thing that I really focus on is the soft skill. I'm a people's person, and I can quickly see and feel if I get that same input and vibes from the other person, and that's what we're looking for. So we need people to support other people because that's the business.
Yeah.
That's unfortunately the business that we're in. The industry is a side business.
Yeah.
We're in the people business.
You're right.
That's
That's the way to look at it.
Mm-hmm.
Yeah.
I think at the like it's a people business on your team and the folks that are coming through the door.
Yeah.
Like those folks should be taken care of so they can take care of your clients, your patients.
Yeah.
But I think that brings it to the whole team, from when you walk in, how the receptionist treats the patient, to getting your cleaning done, to getting a filling done. Like, everyone in the office needs to have that something special to give the patient an amazing experience all throughout. And I feel like we've been doing that better and better as we get along. And I feel like patients are experiencing that as well. I love when we get a review and a patient is like, the experience at JVR Dental was amazing, from the front staff to the hygiene to the filling thing. And it's not just one person standing out. Like, everyone is coming together. Everyone knows when to do what. And that is a lot of systems and procedures in it as well, that's running behind the scenes to make sure when you come in, everyone knows what's happening.
And a lot of that is continuous training as well. We just now in April had a staff training session where we had all the staff together, and the stuff that we trained about, a very small percentage of that was on the technical side of the dentistry thing. The rest was on systems and procedures, on how to treat patients the best when they come in and handle them through the entire process. All of the training, and it's continuous training. You can never stop doing that stuff.
How do you make everybody feel like they're a part of it? Are we listening to everybody? Like, is it an attitude thing?
Yeah.
Like, what do you like if somebody's having a bad day? Like, how does it all? Because you're all stuck in the same office together. Yeah. So
that's a very good question, Marc. I have to make a constant decision to check in with the staff, because I know, and a lot of people out there is the same. Is you get so busy and you have 100 things on your to-do list to get done. But I have a constant note on my to-do list to check in with the staff, and if I know a staff member's been sick or off or whatever, I have to check in with that patient, whether the next day or a day after, whenever, and. We try at least to check in one-on-one with our staff every quarter, and but I have, throughout the quarter, I have more conversation with them, and then we have a longer sort of performance review at least once a year with each of us.
So everybody's sort of in line then. I guess that's important, and there's no finger pointing.
And then I think what Mauritz especially does very well is we have an open door policy. So whenever anything bugs you or you have comments or something, like, people walk into his office daily with suggestions or things, and that is amazing because he actually stops what he's doing and he makes the time for that.
But how much do you appreciate that? Because you're not running on all fronts, so you need to sort of like that information is valuable to running the practice.
Absolutely,
right?
And there's a lot of information and input that I don't hear if just by operating in my space. Yeah. But I hear from the hygienists that some of the patients have struggling with parking issues.
That's a big deal.
So now I know I get that information from them, and I can go to the landlord and say, hey, is this something we can do? Can we help? Can we do something about that?
And just getting it right down to the nitty-gritty detail. Right? Yeah. Absolutely. Yeah, everything, even the subtle things are important. You know, you might not think they are, but to somebody.
Some people, they are.
Yeah, 100%.
And if you take care of those things, that's the things that will show people that we care.
Yeah. And I see this a lot. A lot of people take it personally that, you know, like if somebody's coming through the door and bringing up an issue, it's they kind of take it kind of a not the best way.
Yeah.
So how, like, what's your suggestion in people just kind of defusing the emotional side of it?
Yeah.
And really not pointing the finger and doing the right thing. Like,
yeah, my strategy with this, and it might not work for everybody, but for me, it's just to listen.
Yeah.
And if they complain or suggest or something, my default now is to say, okay, but why? How? Mm-hmm. Why do you have this request? Why is this an issue? Has this been an issue in the past? And keep on asking questions to try and
draw it out.
Draw as much information I can.
Yeah.
And most of the time, a lot of people just feels a lot better once they got all of that off their chest.
Yes.
And there's no real solution to fix it, but they just, no.
I think at the end of the day, we're all humans. We want to be connected. So if we're stewing in our own problems, then it maybe becomes bigger than.
Yeah.
Let's figure it out. My assistant needs some help here. What's going on?
What do you need?
What do you need?
Do you want to go outside?
Do you want to go sit somewhere? It's okay if you do. Yeah, you do? Okay. We'll just kind of take a little pause here and figure it out. Yeah, no problem. No problem. I lost my assistant. It's okay.
We'll try and manage.
So here's the thing, like, you just roll with it. I think that's a good example of, you gotta, like, it's life.
Family life.
Life is chaos. Like, and people are all dealing with their own things too, and I think a lot of people put more weight on things when they're not in a good headspace. Mm-hmm. So you were talking about dealing with that chaos. Like how if somebody's struggling, how do you help them out?
Yeah, for me, as Craig Rochelle said it once in his podcast, that once you get used to the chaos, if you feel that there's chaos around you, then you're in the right space.
Okay.
That's once you get used to that, so it's gonna be crazy, but I'm here, and it's okay to have that.
That gives me some relief, actually.
Yeah. Then you, if everything is going too well, then something.
Then you're not doing something right.
Yeah.
So I that makes sense to me. So like you're if you're not sort of at pushing it.
Mm-hmm.
It's too easy, then you're not progressing, I guess, right?
Yeah.
So when is it too much? When do the alarm bells go off and you need to revisit things then?
I don't know. I normally check out way before that.
That's when you start pointing the fingers. If you did that, I wouldn't be in this position. Taking zero responsibility.
I normally see that in our dinner conversations. When our dinner conversations gets heated and the kids just sort of disappear at the dinner table.
So that's a good point. Like, husband and wife team working together. How does that dynamic work? And if you don't mind me prying, but
honestly, I love it.
Yeah,
no, we don't mind sharing about that.
But like, I don't think we could have grown the office without Mauritz in the office, because it's literally someone that I trust with anything.
Yeah,
we don't need to check in about decisions, any financial, patients. Like, I know he has the best interest at heart, and he knows I have the best interest at heart.
Yeah.
So that is honestly, like, you've been in the office for 4 years, almost 5 years now.
Almost 5 years now.
August will be 5 years.
Yeah.
And it's honestly been absolutely amazing. We don't really see each other in the day. Mm-mm. That's why sometimes dinner conversations get heated, because that's when we get to discuss stuff. But it's amazing. I would not have it.
Share an office, but we never work together in the office.
Yeah. But like your focuses are on the same thing.
Yeah, but different areas.
That's right.
But I think that's why it works, because we fight for the same goal, and we have the same interest at mind, but we work on opposite ends of the business.
Mm-hmm.
So which is nice. Even if I want to, I can't interfere and in the areas that she's working, and although she can, but she doesn't like to interfere in the areas that I'm working, and we totally fine with that, and the one support each other. She won't be able to do the dentistry and the nice stuff that she's doing if she doesn't have a business, and we won't be able to have a business if we don't have her doing the dentistry. So we'd support each other nicely, and it's one collaborative effort.
It's a really mission critical piece to the practice. That you said it's the business, really, and it's the yin and yang. Like if the more that the business is in line, and there's patients coming through the door, and the books are all in line, and systems are all in place, the more you can just focus on.
But I think that is the thing that we had to work really hard with in the beginning and still today, but to get that balance between the patients, the staff, the business, and then putting your family in it as well.
Yeah.
And we're definitely a family-orientated office, and our kids are in the office a lot. Zanika got braces in spring break because she was in the office, and one of my patients didn't show up. So it's like, perfect, let's do braces. And she probably isn't that stoked about it.
Yeah.
But that is like, if my kids will be in the office, and if you have a problem with Arilyn walking in during a procedure, then it's probably not the office for you. Mm-hmm. But that is the thing. Like, we want people and our family to be comfortable in the office, right?
Yeah, I brought my Mackenzie there. Yeah.
Yes.
Yeah. So, yeah.
So
knowing
that
that,
is,
yeah.
right.
Yeah, exactly.
And that's the thing. Like, Arilyn was in the office this week, and there was a girl getting her teeth cleaned, and she didn't want to do it. And Arilyn stood next to her, and she's like, "Don't worry, you got this. Like, it doesn't hurt."
Yeah.
And the girl opened her mouth, and she got her cleaning done. And I'm like, okay, my little helper.
Are they all going to be dentists, you think?
Arilyn wants to be a vet. Zanika wants to be a dentist.
There you go. Yeah.
Aiden wants to be Spider-Man.
Yeah. Oh, that's pretty sweet. That'd probably be my choice. Swing around the city. Yeah, that's my choice. Sorry.
Yeah. But our whole business philosophy is how we operate is we do what's needed for the patient, and then the financial side of things and those kind of that is a byproduct of giving good service.
Yep.
And if that's the focus, and that would be my advice for any young dentist or anybody that's starting, is say, yes, it's important, track the finances, track the stats, know how your business is functioning, but don't make that your focus.
Yeah.
Make your focus customer service and good custom care, and the rest of that will be byproduct.
Well, I mean, I've seen it. It's I've seen a dead practice. I've walked through the door with the the dentist at the front desk thumbing through the supply catalog looking for the best price on a mask.
Yeah.
I get it.
Yeah.
You got to watch your overhead and things, but
100%.
It was a Wednesday in the middle of the day.
Yeah.
And it's not a brand new practice.
Yeah.
The focus is taking care of the people. The people will come and
But I think also we had this discussion. Like, dentistry is growing. There's constant growth in a dental office, whether it is your clinical skills and implementing new technology, and everyone needs to learn that, like, that's growing. But also the patients, like, you need a constant inflow of new patients, because especially now there's a constant outflow of patients in the Lower Mainland as well, because housing is becoming unaffordable. Mm-hmm. So you always need to stay on top of that care and that experience that you're giving the patients. Mm-hmm. But with that is everything is just constantly changing. And if you don't have the personality to keep up with those changes, you're going to fall behind. And that is when you get staff as well. You need staff. Like, my staff hates it when I go to a conference, because they're like, what are you bringing back? Because most of the times when I go to a conference, I'm bringing back some sort of technology that I'm like, this is going to make our lives easier. Yeah. But you have to embrace that. And that is part of constant growth as a person, clinical skills, patients, staffing. Like, you need to stay on top of that. And I think it's really hard once you're kind of off that bandwagon, then it's starting to cost a lot to get back to it. So there's definitely a few things that I'm like, if I have to do a startup practice, I mean, I don't say start up a practice with all the technology. It costs a lot. But you have to start with at least an intraoral scanner. I looked at a laser for years, like actually probably for 4 years before I actually jumped on and bought a laser. And I love my laser. And I can't see my life without it. But that's the same with an intraoral scanner. No matter what scanner you have. I talked to a dentist yesterday and I helped her with crown preps. And I'm like, you need an intraoral scanner. Like, I don't get how you can still do dentistry without it. Yes, PVF impressions is amazing.
Yeah, it still works.
It still works, but if you want to start to get to that next level, and that's what I learned really early in my career as a business owner, is to not, with whatever technology you integrate in your office, do not limit your growth. And I did it in the beginning. I was like, I will never do implants. I don't see myself ever doing that. I'm just getting a pan machine. And then 4 years later, I basically donated my pan machine and bought a CBCT. And now we use CBCT for endo, for Sure Smile, for implant planning. Like,
how cool is
right?
that piece of technology?
And that's the thing. Like, once you get to, now you can overlap your intraoral scan with your CBCT. And making that connection and actually seeing what's going on underneath the tissue and what's going on in the tissue and in the mouth, like that is just an amazing added bonus to do implant planning, to do ortho cases with, because you actually know what is going on.
Predictability.
Like, right? Predictability. Yeah. If you have predictable results, you're way more profitable. Because you're not trying it this way and then trying it this way. Like, I know if I do an implant planning with guided surgery, I know exactly where that implant is going in.
Take all the risk out.
Right? Yeah. It is
and not just for us, for
amazing.
The patient too.
For the patient as well. And you know when to refer.
Yeah. Yeah, well, exactly. Yeah.
Right? Like, we're not doing everything in-house.
Yeah.
Like, but you know your limitations, but that is just adding to knowing your limitation and knowing what you feel comfortable doing.
Yeah.
And that is, I think, amazing to be like, yes, we can do all of this, right?
And I see the light in your eyes when you're talking about
technology.
I know you love it. And you know, every veteran I talk to they're keeping up with it all. Like still, like they're still going to courses, they're still researching technology, they're still taking as much CE as possible. It keeps your interest in the game, I think, right?
An interesting thing is I was on a call yesterday, and there's such a big change in how people are doing CE. And I think in the next few years, we're going to see a lot of, we'll have to pivot in how we do CE and where we find CE. Because a lot of people, it's way easier to do it online.
100%, yeah.
And I mean, for me as a mom, I've done courses online that I've never would have done if I couldn't do it online, because it is harder to travel when you have 3 kids, right? Mm-hmm. But you still need a part of that hands-on as well.
I was just going to ask, like, how does your mind get? Is there some component where you're going at some point and you're in class, or hands-on?
I think we're going to start to pivot more to smaller group settings.
Okay.
And actually making that connection. I did a Sure Smile course last weekend, and it was amazing to actually meet the people in person. Mm-hmm. And they've all done online training and everything, but just having that personal connection to someone that's been there and done it. So I think we're going to see, I don't think online is going to go away. I think there's a big part of it, but I think we're going to see a growth in smaller, I don't want to say study clubs, but smaller, intimate training where actually, okay, you have the basic knowledge from online, let's help you do this hands-on. Like, let's get a patient and actually do guided implant surgery. Let's get a patient and actually teach you how to do a scan in the patient's mouth. Because it's way different using an intraoral scanner on a model than actually doing it in the mouth.
And they're night and day different, right? Like, you don't have to deal with any liquids.
And those things you can't teach online.
Yeah.
Like dentistry is hands-on. So some of it, but I think we're going to move to smaller. We're not going to sit in big lecture halls anymore. We're going to get into a more smaller, intimate training.
I think the biggest challenge is going to be to figure out what is the best training to be doing hands-on and what training it works better on online. And it's finding that sort of balance. Currently, it's either everything online or everything hands-on. There's no proper balance. I think over the next few months and years, people will start to figure out we do this online, we do this hands-on, and we
that's how I see it working too. I see, the whole sort of the educational side being done on the slides and all that stuff being done online, and then maybe sort of locally. Like not every company has enough bandwidth to do that, right? So each individual company and product's different.
Yeah.
But what we lack with the whole online thing, and I've run a few online courses myself, and the best results are to do it that, offer it so that people can be there live as well. So you have a live audience, and then you have an audience that you're bringing in online, but make it so that if anybody has a question, you can hear the audience in-house and you can hear the audience at home and keep the microphones on. Nobody's sitting with a blank screen.
Yeah.
You know what I mean? Like, everybody needs to be engaged. And I know that there's some people that sign up for things just to get the CE credits.
Right.
But like, let's get those CE credits and just make it purposeful. Like, you're not just accumulating your CE because you have to. How is that bettering your practice?
Yeah. But that's why I think you definitely will have to start to get more intimate groups and do hands-on training. But I think with that is because people are so used to doing it out of the convenience of their own house or practice or like driving, there's a lot of places, right? But so I think education people will have to start to travel a little bit more, that we don't have all the training in Vancouver. Like, we'll have to start to do the trainings we offer in Vancouver, in Kelowna, and in Prince George.
Right.
Like, you'll have to start to travel a little bit more or get more trainers that can do the training to be able to be like, okay, you're not traveling 4 hours, or you don't have to get on a plane and fly for 3 hours.
I've got a new business model.
Right?
We're working on this. Smart, actually. Like, having it in pods.
Yeah.
Where you can go to a city and you've got, 4 or 5 clinicians that you're in somebody's practice.
Yeah.
There might even be a patient that's come in, and we're doing like a live work with the training and people. Another thing that, like, bringing everybody together, when the course is all said and done, everybody still communicates, right?
Yeah.
So there's usually like a WhatsApp chat or whatever where people are, hey, I've run into this issue.
Yeah.
Have you seen this? Right.
Yeah. And I think that's a little bit of courses that I attended to, the in-person courses. The most value I got from the in-person courses was the coffee time chats and the lunchtime talks and the connections that you build there. The technical information that you get from the is cool and valuable too, but those connections outside of that is invaluable.
So whenever you're learning something new, to just be kind of, okay, off you go on your own with it. There's something to be said about that level of extra boost of confidence you get when you've got other folks out there that are in your shoes doing the same thing, and that the people that have trained you, the people that have spent the time to bring you to that level they're a phone call away or text message away.
Makes a huge difference.
Like the stuff that doesn't, like, and also there's built in, like, there's next steps to it too. You got a clear sort of, you're going to finish this piece of the education and you're going to be able to do this.
Yeah.
The next step is we're going to do this and it's going to take you to there.
Yeah.
Right? There's like a roadmap for it all.
Yeah.
Yeah. But on the new technology, and I think that's where a lot of officers stumble as well, is they attend a course, they buy the piece of equipment, but none of those suppliers or courses give you the rollout plan.
Yeah.
On how to roll it out, because a lot of those technology, you have to engage your entire staff.
Yes.
SureSmile is a great example.
Yeah.
It's amazing product and all of that, and they train the dentists really well. But in order to do SureSmile in your office, you have to engage the patient and talk to him about it properly. And there's a huge financial aspect on it.
Yeah.
There's a huge insurance implication on it. So all of that needs to be in place in order to do one case.
Yeah. You know what? You know how many courses and things that I've been to that it just blows my mind that there's no, okay, here's the script on the questions you ask your patient about this. Yeah. This is how you get started.
Yeah. And that is 100%. Like, SureSmile is a really amazing one to bring in, because that is statistically 2/3 of adults need some sort of orthodontics, right? But I can't just walk in and say, "Hi, I'm Dr. Lundt. You need ortho."
Yeah.
And it costs $6,500.
Yeah.
Hang on, I gotta check to see if there's room on my credit card.
Right?
Because I'm not covered.
You probably don't.
Yeah.
Right. But it is starting with the hygienist educating the patient that where the calculus is, where the crooked teeth are, where it's hard to clean. Those are the spots that if we straighten that, makes it easier. And I had a patient, she is on her last tray now. She was in hygiene this week, and she was like, I can't believe how easy it is to floss. So like, for the first time, I feel like I'm actually cleaning my teeth.
Oh, that's awesome.
And I'm like, that is why you have to do it. Like, we want to keep your teeth in your mouth. But that doesn't start with meeting me and being like, you need ortho, right? Like, a lot of my ortho cases comes from patients that has been patients in my office for 2, 3, 4 years.
Yeah.
And we just keep educating them. We keep doing their scans. And that's a nice thing of having the capability when we scan our patients every 2 years. You can actually show to them on the screen, because teeth always move. And people don't realize, but if you get to like 2 years, 4 years, 6 years down the line, and you can see, oh, 6 years ago, this was my teeth, and now this is my teeth. Like, they're actually not lying. My teeth keeps moving, and that crooked tooth keeps moving. Like, educating them and co-diagnosing with them, then they start to put value to their teeth and value to what we do as dentists, and you don't have to sell anything.
It goes back to their initial part of this conversation. It's all about that foundational piece, right?
Yeah.
The journey. How much of this conversation starts in that hygiene chair?
99.9%.
How important is hygiene in a clinic?
Right.
In our clinic, especially, we basically funnel our entire patient base
through hygiene.
Through hygiene, in order to get to the rest of
the
office.
That's your retention. That's the Yeah.
No, and that's where the education is, and that's why it's so important to continually educate the hygienists as well, because for them to stay on top of things, for them to talk about, we now have a thing called myofunctional therapy that our hygienists talk about the patient on how your tongue position and lip position is, and breathing through your nose and all of those kind of things. We never talked about that 5 years ago, but our hygienists kept on educating themselves, and it's another tool in their pocket that they can use.
So is there sort of like a curriculum that you have in place? Like, how do you, everything that you want your team to be talking about, do you make that information readily available? Like, how does that work on your clinic level?
Yeah, at this stage, that's probably an area where our systems lack a little bit still. We don't have a formal sort of education plan for each of our staff members.
Yeah,
we're fortunate enough to have strong staff members that strive to educate themselves.
Right.
So, like the myofunctional therapy, that the hygienist specifically said that's one thing she wanted to do, and we support her in that. But that's some of the procedures that we have to get in place is to make sure that we keep on training our people on at least a minimum standard for every staff.
I think especially we have a new receptionist, and laser dentistry is something that not a lot of dental offices offer, right? So in the first week or two, she had a few questions from patients about the laser. And we ended up actually in one of our staff meetings, because I present on technology in dental offices. I was like, I have this presentation, but I've never actually presented it to the staff, right? So let's take the staff through everything, because my assistants knows all of that in detail because they work with me every day. But making sure your staff actually, everyone knows, because most of the times the receptionist is the one that's getting the questions. So making sure that they know, okay, this laser we can use for this and this and this, and these are the people that's trained on it. This laser, all my hygienists are trained on the laser as well. So all my hygienists are allowed to do cleanings with the laser, which is amazing. But the hygienist knows it, but does the receptionist knows it, right? Yeah. So it just comes back to keeping that loop and making sure everyone is informed, and not just, this is what it is. It's back to everyone in the office needs to have the same communication. And if everyone doesn't know what we offer in the office, they won't offer it.
Yeah.
And if I, as a dentist, offer it, the patient is like, oh, what is she trying to sell? Right? But if it comes from your staff and they can see the results and they know what's happening, that is way easier to have those communications with the patient as well.
What we do to keep these sort of communications going and on an ongoing basis is we have a staff meeting once a month with all the staff, and then every other month we have department meetings. So every for 3 Thursdays in a row we have the admin team as an individual meeting, the hygiene team, and the CDA team. And then during those meetings, that's when, especially in the department meetings, that's when we go into the details and the nitty-gritties of systems or technology or treatment or
tweak.
Yeah.
All the time.
It's constant.
And it has
constant.
Well, we talked about it. Like nothing ever stays the same. Like especially in this industry, there's so many things being thrown at us.
Yeah.
So to have that regular conversation is mission critical.
Yes, for sure.
So in terms of communicating with the patient, is there sort of, what's the philosophy there in like a consult type situation? Are there before and afters that you're showing examples? Are you showing, 3D images? Like how does that play out?
Yeah,
we basically have everything.
But
maybe the new patient process would be a good way to.
Yeah, so we do. We scan, and that is probably one of the biggest things that we use. And we have intraoral cameras on all our chairs. So while the hygienist is cleaning, they take specific photos. So when I come in to do the exam, all of those records are done already. So the hygienist basically starts co-diagnosing with the patient already. So when I come in and I reinforce, the gums here looks inflamed, like because of this and this and this, we want to see you in 4 months and not in 6 months. Or I can show them the intraoral picture and the scan. What is nice with using both of that is a lot of the times when a patient's tooth is cracked or fractured, when you actually turn on the occlusion, you can see that the occlusion is really hard on that side. So that is when you can start to talk about possible night guards to protect it and start to incorporate Sure Smile and be like, if we fix your bite, this will make a difference for you. There's also on this call, they have the Sure Smile simulation now that you can do. And that is awesome. It's not something I bring up in new patients' exams most of the times, unless my hygienist has started that conversation. And I just know that she started the conversation because when I walk in and the Sure Smile simulation is already on the screen, I know after my exam, you do your extraoral exam, do your intraoral exam, go through the scan, and then if the conversation leads to it, I bring up the Sure Smile simulation and you can actually show them before and after of their own teeth. And that is an amazing tool to have and actually use the technology for co-diagnosing.
Absolutely,
and you don't have to persuade anyone.
Yeah. The iTero has the same software set. Yeah, it's awesome.
And that's, it's amazing. The things that scanners can do these days is phenomenal.
They're all accurate. They all take a great image. Now it's all about like what sort of software is backing them.
Right.
Yeah.
The software, and then I think, again, not limiting you on what do you want to do. Do you want to get into designing and milling your own crowns, or do you want a scanner to just send to the lab?
Yeah.
Right. Like there's different implications for it.
Yeah.
If you want to do clear aligners, you need a scanner that's compatible for whatever clear aligner system you want to use. And make sure if you have a scanner, you can do whatever you want to do. So it just comes back to, again, when you get technology, make sure you don't limit yourself in what you want to do, even though you don't think you want to do it. Buying the same technology twice or 3 times because you're like, oh, now I want to do this. Oh, now I want to do this. It's do that research ahead of time. And don't limit yourself with whatever technology you get.
And also, once you buy it, yes, there's going to be a better model. So
always.
If you're going to wait, there's always going to be something better. You got to just jump in.
Yeah, and then I think, like, if you get any technology, make time and learn how to use it.
Absolutely. Like you were saying, your laser, you took 4 years.
Yeah.
Yes.
4 years to research and think about how it fits, which one would do the best for how you wanted to use it in practice.
And that is probably the machine that I use the most in my office.
Yeah. But also because when we bought it with intention, we bought it and then you say, okay, now we can look for places to use it.
Yes.
Because there's a lot of people, again, they don't buy the laser and have a rollout plan. They buy the laser, not sure where to use it, what to use it for, and then it becomes a very expensive coat hanger.
Yeah.
And that's the worst that I want for anybody who's paying a lot of money for technology is have some sort of plan before you buy it on how I'm going to try and use this and roll this out. But a lot of the things is to engage your entire team. Because when your team starts to talk about the laser and your reception, everybody start talk about it, then it's a lot easier.
Yeah, you can't carry it all on your own. Yeah. Like it's like the hygiene, having the orthos.
The best thing in my day is when I walk into hygiene and I can see how my prime scans are moving, and I'm like, this is perfect.
That's amazing.
Like I don't want the scanner to be in one op for the whole day.
No.
Yeah.
Like I want to come in and every time I get into the hygiene side, the scanner needs to be somewhere else because then I know everyone is utilizing it.
Yeah.
I love it when they come and get my prime scan on my side because they're like, oh, like both patients needs to be scanned now. But doing a full mouth scan in hygiene takes 3 to 5 minutes.
Mm-hmm.
It takes longer to take intraoral pictures. So I'm like, the scanner is definitely an added bonus to that. And if people are starting to look for the camera, I'm like, what are you taking pictures of, right?
Yeah.
So it's amazing to actually see the things are working. To be in a morning meeting and be like, okay, laser has to be here, laser has to be here, laser has to be here, right? It comes with
a challenge, but
it comes with planning.
Yeah.
But it's amazing to be like, okay, like we have the technology, we use the technology. Now it needs to work with the schedule. And that is something we can figure out. But at least we know everyone in the office is using it. Right?
And you're maximizing the ROI on that investment.
Yeah. So.
Yeah. As a business, that's important.
Yeah.
Right? Especially some of these bloody things are not cheap.
Not cheap.
So my nightmare as I was a supply rep for a few years. My nightmare would be to sell something that would be collecting the coat hanger.
Yeah.
No,
Yikes!
That's awful.
Yeah,
because I think it's the responsibility of the companies that are selling these things, if they want to be successful into the future, to ensure that you're selling this stuff, that you support it into the future. You know what I mean? Like
supporting and making training easily accessible.
Yeah. I mean, it's a good way to get return business.
Yeah.
If you take care, your patients are going to come back if you take care of them.
Yeah.
The dentists are going to come back and buy the new cool laser if you take care of them.
Yeah. So it's amazing.
Yeah.
But again, like it comes back to having the right team around you.
100%.
From sales rep to whoever is teaching you how to implement it, and like just that whole network around you is amazing. And that is probably one of the things where you were saying shopping around for masks. Like, I don't do that because I have a really good relationship with my rep. So I know if I'm ever in a pinch, I feel I can pick up the phone and be like, I need help. And they make things work for me. Right? So that is amazing. Where if you keep jumping and price hopping for every little thing, yes, like you're saving some money, but you're not building the relationship. You're not getting that support around you for people that will move mountains to make sure you can serve a patient.
And I argue, if you were to like spend the money on the right things, those things are going to make you money. Like, I wouldn't be focusing too much on saving at the end of the year $6,000 on disposable stuff.
No.
I mean, keep an eye on it so that you know the people are being responsible. That's the biggest fear, obviously, with that. But what's next? Like, everything's going well. The expansion's been done. You're on the world stage here now for DS, which is amazing. How much fun has that been?
I think that is kind of like the next level for me personally is getting more and more into the training part, which I absolutely love because I love that connection. I love helping people because we had some struggles. And if we can help anyone not have those same struggles, that will be my goal. So currently I'm on a global KOL for SureSmile. So I train for SureSmile, and I'll actually be speaking at DS World for Canada. So that is fun. Amazing.
Yeah, right on.
That's in September.
That's in September.
Is there any extra spots for Mauritz and I?
Mauritz is of course going.
I was more thinking about myself.
He just needs to be in the front seat smiling at me.
You push luggage around to make sure
you need somebody to come and do video, right?
100%.
Talk to your people.
So that is kind of the big one this year. I'm going to Germany for restorative and CAD CAMs, so that will be amazing. And I looked at the itinerary this week, and it's amazing to be like, oh, everything that we're going to talk about is stuff that we have in our office, products that we're using, from Primer Bond Active that was newly released this year to the Tessera blocks that we use. I know Stanley at Crown Dental is amazing with incorporating all of those stuff as well. So I'm like, if I'm like, I need a Tessera block, Crown, he's like, yes, we're on it. And just kind of knowing the products that's out there and the limitations, because with anything that you do, there's always limitations to a specific product, right? So understanding that and just knowing how to educate people when to choose what. Because I'm joking, but I honestly feel like we use the best equipment and materials in our office for a reason. But it's also nice to know why I see it as the best, right? Like, so understanding exactly how the materials work and everything, that's kind of what the whole Germany trip will be about. And then coming back and teaching people about that and incorporating that into this is the whole spectrum and how everything links together again.
Isn't that like just like one of the purposes of life is we're not here forever. So if we have all this information, the next appropriate thing is to teach somebody else.
Right. Yeah. And that's a thing. I feel like we have that patient connection now, but actually getting the professional connection and helping other dentists get the most out of dentistry and loving dentistry the way we do in our office, that is kind of like having that fire and that passion for it.
Yeah, it's amazing. It just re-energizes that for yourself,
right?
Too.
100%.
Yeah.
And sort of in-house the future for us with her doing more of the training, we still want to maintain the same patient care that we do in-house, even if she steps away from the chair here and there. So we were working hard to get our associates on that same same level as she is. So I don't think in the near future we're expanding our team too much. We maintaining our team that we have, and then we also no technology is off the table at this stage. No new technology is off the table yet.
That's going to be my next question. What's the next piece of technology you're eyeballing?
We'll wait for DS
yet.
World and see what they come up with.
Are you 3D printing yet?
We've kicked the 3D printing idea around a little bit. I think it's a great technology and it would add value in certain areas of our workflow, but we haven't pinned it down exactly how we would roll it out and we would best utilize it.
I mean, to be honest, Stanley is so amazing with the 3D printing for us.
Yeah.
So at this stage, the turnaround that I get from Stanley is almost the same turnaround I'll get from doing it in-house.
For sure. That's another really interesting conversation, laboratory and practice and where a laboratory fits into it all with everything really going.
Yeah, I don't think you can minimize your work with a lab, but I think if you want to be a good practice, you need a good relationship with the lab.
Yeah, let's talk about how important has Stanley been over the years for you guys?
Amazing.
Yeah.
Stanley Crown Dental.
He's amazing.
Yeah.
No, it's just like, honestly, the things that we get done and everything around it is just amazing. Like and even kind of training both ways. Like we've helped him with some things on designing on CEREC and things. And then on the other side, he's like, okay, I've encountered this. And if you try this, let's see if we can get better results. So it is, I think that is an amazing relationship to kind of learn both sides, because he knows we're doing crowns in-house as well. So just getting that to how we can do it properly for both sides, right? And having that open relationship basically and learning from each other to be like, okay, we've designed this crown, these were the problems we ran into. And he's like, okay, have you tried this and this and this? Or on the other side where he's like, I got this scan from someone and I'm struggling to see their scan. What do you do that I can tell the other dentists, like, this is kind of what they do? Because it's way different just scanning and sending it to the lab than scanning and seeing your scan and trying to make an actual crown fit on your prep. I feel it makes you a better technical dentist to see your work blown up and you design the crown and you fit it and you're like, okay, like now I get why the lab is sending me crappy crowns, because it's actually my design, not the lab, right? So it's nice to understand both sides.
Yes.
And being able to learn from each other in that way, because it makes a big difference.
It impacts outcome. Outcome is a crucial piece, right?
I feel like before we started doing our own crowns, it was always easy to just be
we're timing out again.
No.
Life as we know it, right? Did she have these?
Sure.
Thank you.
Thanks.
You're amazing.
That's a good segue into how do you manage family with a thriving practice and traveling, and how, like being a mom and dad, like where does that all fit into this?
Marc, I think that's one of the reasons why there's many reasons why I joined the office, but that's one of the main reasons. Is my previous job, I loved it. Mineral processing was a true passion, still is a passion for me. I love that. But in our family dynamic, with her having a full schedule, we need to balance life with the kids too. Me running the office, I can be there during the day, but if the kids needs me, I can easily step away and do that. And a lot of the admin work and stuff that I do, I can do after hours too. So there's literally some days where we switch places. I'm at home and taking care of it as soon as she gets home and say, okay, kids are yours, I'm off. We literally operate like that. But for me, it's not a burden. It's an absolute privilege to be able to do that.
Oh, it's amazing.
It's amazing. And then for that reason, our office still operates only 4 days a week, Monday to Thursday, because if we're done on a Thursday, unless we have admin to do, we take a break and we head down to the cabin at the break and spend
Have
time.
fun.
I'll be
Family
honest, like I'm passionate about my stuff too, but the time that I get to spend with my kids is that's what it's all about.
Right, that's what it's all about.
So that's
100%.
what you try and fight and be more efficient almost to preserve more time for that, right?
100%.
It's like we talked about it.
I'm like, in the end,
time flies.
right? But in the end, that is you work that you can provide for your kids.
Yeah.
But the most important thing, we listened to a podcast this week, the most important thing is to actually be there and spend time with them.
Yeah.
Right. So that is definitely making sure you're not just head down, work the whole time and just throwing money at them, because that's not what they need.
Or a screen, right?
Right.
Because eventually they'll be sitting where we're sitting right now, figuring it out the next problems to solve. Yeah. So we have to make sure that we teach them.
Yeah. And that is honestly, like, just having Arilyn here today.
Yeah.
That is one of the things. Like, I also feel like they need to know we have jobs and we work hard.
Yeah.
Because that is giving them some tools in life as well. And life doesn't just come easy. You need to work.
And include them when you can.
Right.
All right. We're back. She's been good. This has been an hour. So she was here for a bit. But let's I think maybe put a cap on things.
Yeah.
So I'll let you guys on your way. We've looked at 3D printing. That's sort of on the radar. You're doing your research. Mm-hmm. What's next for the practice? What's sort of next? Gleaming. Everything's kind of set up now, really, right?
Yeah, I think over the next few years will be more just to stabilize the ship now.
Yeah,
and make it more stronger, a little bit more bulletproof in that sense.
Yeah,
so that the systems and stuff that we worked on so hard is just sort of becomes natural. And, I never say never, but we're not sure. If
you're gonna buy another practice.
Another clinic is the
Are you gonna do it?
Not now.
At this point, we're not limiting.
No. Has that ever been a thought?
It has. It has. Just on being able to manage different spaces as efficient as we would be able to do it under one roof. We haven't figured that out yet.
Yeah, come on, Mauritz.
Get
it together. Figure it out. You're going to start your own franchise.
But one thing, as we said, as Leana said, the training part for her is awesome. One thing that I would love to do is to, if I come across somebody that say, okay, I'm going to start things. I'm not sure where to start, but I'm going to do my own thing. I would be more than happy to jump in there with them and say, okay, awesome. I can give you some guidance. I'm not a professional trainer in that sense, but I can at least tell you the mistakes that we've made.
That you don't do it.
Yeah. Have you explored that? Like putting something together, like a course of your own?
Not yet. No.
Let's talk. I
keep him busy at this stage.
Yeah.
But that is definitely, I think that's a passion for both of us.
Yeah.
Like I say, we've been blessed with an amazing 8 years behind us so far. Mm-hmm. But we've learned some really hard. Yeah. We've made some really hard mistakes. We've learned some really hard lessons in the process. And if we can help anyone with that, it would be great.
If I think back on what made things easier for us is, again, I got connected with the right people that helped me. Henry Shine, when we expanded the office, was amazing for us. Dentistry Corona, the reps for all the different aspects. Live in our neighborhood.
Yeah.
So those kind of things, it's not necessarily we that did things differently. We just got connected with the right people and we made wise decisions with the right guidance.
Yeah. Everybody brings their knowledge base, right?
Yeah.
You don't know I think, well, it was like Einstein or something. Somebody said that, the true show of intelligence is to realize that you really don't know anything at all. There's so much to learn.
Yeah.
And there's always something, whether you're a complete master at it, there's something to learn still.
Yeah. Still,
No, for sure. So I'm like, just keep learning.
Yeah.
Keep implementing new stuff, making new systems and procedures, and getting a bulletproof. Yeah.
And keep you keep your passion with it too, right? Like keep the fire going and pushing your, like push yourself into the chaos.
Yeah.
And one thing for us, because we've been working so long and we know how things should work, but lately what I've started doing is if I were to step away and say, okay, did I put enough stuff in place that if I step away, things will just carry on the way it does? And there's a few gaps there where we don't have procedures properly written out, properly nailed down the way it should be. So those are the things that we're going to work on in the next few years to make sure that we establish that, so that any new person comes in, if there's all of a sudden a new takeover of the entire team, they will just take those procedures and carry on.
Yep. See you later. Got this.
Yeah. And
No,
It's
mine. No, you can't do that. It's mine. It's my baby.
Yeah.
Well, thank you guys for coming in. This has been awesome. Any imparting thoughts? That was kind of your imparting thought. That was like sort of my next thing.
Never stop growing.
Never stop growing.
Thanks for having us, and we've been growing with you along with these podcasts. So it's been awesome for us too.
Yeah. This is coming a long way. I've got a room here now. Who knows what I'm going to have next, right?
Yeah.
I love it.
New gadget, new light on the wall.
Thanks, Marc.
All right, guys. Thanks again. Bye for now. Boink.